Hello, my name is Peggy Bratt and I'm a certified athletic trainer with Blount Memorial Total Rehabilitation. I am the sports medicine manager for our sports medicine program and head athletic trainer at Alcoa High School. Blount Memorial Sports Medicine Outreach Program provides athletic training services to Alcoa, Eagleton College and Career Academy, Greenback, Heritage, Maryville, Maryville Christian, Sequoia, William Blount, and Clayton Bradley STEM Academy. These services include on-site athletic trainers for sanctioned high school sports contests and athletic trainers traveling to away contests with football and basketball. Athletes also have access to a free injury clinic that takes place every weekday morning at 7 a.m. at our Total Rehabilitation Cherokee Clinic. This injury clinic allows your athlete to be evaluated for free by a licensed athletic trainer and then receive appropriate care to manage their injury. If the injury is minor, then an athlete can receive up to 2 weeks of free rehabilitation services focused on healing their injury and returning them to their previous level of function. If the injury is more serious or uncertain, the athletic trainers can schedule a same-day or next-day appointment with sports medicine physicians. This enables the athlete to receive the proper treatment for their specific injury as quickly as possible so they can return to participating in their sport. Another important aspect of our sports medicine program is injury prevention. One of the best ways to prevent injury or further injury is through education. Our primary sports medicine physician and the medical director of our program is Dr. Ben England. He will now give you some further information on 3 serious and life-threatening events and discuss how we can help prevent them from happening to your athlete.
Hello, my name is Dr. Benjamin England and I'm a sports medicine specialist with East Tennessee Medical Group. I'm here today to talk to you about 3 different subjects that the TSSAA feels are important for parents to understand. The first subject we're going to talk about today is sudden cardiac arrest. This is a heart condition that is typically structurally related and inherited. It's not the same as a blocked artery or a heart attack like you would experience as an adult. This results in arrhythmia or an electrical problem in the heart that causes death or symptoms that can result in fatigue, dizziness, or fainting. When a student athlete experiences these types of symptoms, including fainting, unexplained shortness of breath, or dizziness, these need to be evaluated by a physician. A lot of the health screening that we do as a pre-participation physical is to help anticipate these types of problems and identify these patients before they have an event. If they are removed from play because of these types of symptoms, they need to be evaluated by a licensed physician before they can return to play. Being aware of the symptoms of our patients seems to be the best way to pick these up early. The next subject we're going to discuss is sport-related concussion. A concussion results as a trauma to the brain of some sort, such as a jolt or blow, or sometimes a strict rotational force that causes dysfunction in the brain. It's not the same as a skull fracture or bleeding in the brain, but it does present with neurologic symptoms. They can be as simple as a headache or blurred vision, or as serious as loss of consciousness. Typically, when a patient is suspected to have a concussion, they are removed from play immediately and then evaluated by personnel on site. Sometimes we refer these patients to the emergency department for further testing, such as a CT scan. The CT scan is not to evaluate the concussion, but more to evaluate for more serious trauma to the brain, such as the skull fracture or bleeding. When a patient is diagnosed with a concussion, they're not allowed to return to play until they've been evaluated by a physician, their symptoms have improved, and they've gone through concussion-related protocol. These protocols are done in conjunction with your athletic trainers at each school, and they're standardized across all sports in most countries. Symptoms of a concussion can be as simple as a headache, blurry vision, dizziness, light sensitivity, but sometimes patients also have loss of consciousness, forgetfulness, gaps in their memory, or even a mild seizure. Please refer to your handout for any other questions regarding the symptoms of concussion. If you suspect that your student athlete has a concussion, please report this to the coaches or athletic training staff, or have the patient evaluated by a physician urgently. It's important for the patient to report any concussion-related symptoms without any hesitation. If a patient continues to play while concussed, this can result in longer symptoms, worse symptoms, and sometimes more serious injury to the brain. In rare episodes, these can even result in death. The last subject we're going to discuss is heat stroke. Heat stroke results when the patient's body temperature and brain reach a temperature over 104.5 degrees to the point that the brain no longer functions properly. This can result in organ failure and lead to death if not treated promptly. The standard treatment for this is still cold water immersion. This is done either with a tarp or some type of tub on the sideline with ice water. The patient is monitored until they regain consciousness and are stable. After that point, they are typically evaluated at the emergency department. Heat stroke is best prevented by avoiding excessive heat training, and this is why we have regulations on temperature and training regimens. The acclimatization period of every year, where patients get used to the heat before we do more excessive training, is part of that process. When the temperature is too high, they're not allowed to participate in sports. In regards to these three conditions of sudden cardiac arrest, concussion, and heat stroke, your athletic trainers are very educated and skilled in this, and we drill every year on making sure these are treated appropriately. Please ask your athletic trainer for any questions you may have regarding these, and I'm glad to see your patients at any time for any questions or concerns. Thank you very much.